Rob Allen from HIVSA. Thanks for joining us on Tech at Work.
Thanks.
Before we delve into mobile health services, can you give us a bit of a background behind HIVSA?
HIVSA was set up 10 years ago. It provides support services for people who are infected by HIV pandemic. We don't deal with the medical side of HIV, we deal with all the support side, the psychosocial issues, all the other problems that people are facing HIV. And whenever we see new opportunities to develop programs which may assist people, we try and be innovative and come up with new solutions.
Africa is notorious for its lack of and access to healthcare. How are mobile health services helping with this?
Well, there's a load of ways which mobile health services can help. The fact is, at the moment, that most of them are in pilot stages. Very few are rolled out fully throughout the continent. But they can help in connecting people up with the health providers, and they can help in providing a lot more health information for people. So, for instance, in the same way that people may well have to travel 50 or 100 kilometers to a clinic, that's the only place people would usually get health information from. By being able to access health information on their cell phone, they don't need to make that 100 kilometer journey, perhaps. And in other ways, they can certainly be connected up to via telemedicine or health call lines. They can be connected up to get more information about making the right decisions about their health and people they care for.
HIVSA has developed its own mobile health system called hi4life. Can you chat to us more about this?
What we've done is we've basically seen the need for better access to health information, and we've tried to develop a whole set of different services which people can just go onto any phone and access a load of information around sexual, reproductive health, around motherhood, fatherhood, around looking after babies. And these are particular issues within South Africa, especially around HIV and this massive issue around maternal and infant mortality. So what we're trying to do is we're trying to say, okay, if your baby's ill, go onto this service and then find out what you should do. Often it's you should go to the clinic and get it sorted out properly. But we try and give people a bit more impartial advice around it. We try and provide information around HIV and make sure that a lot of the myths that go around can be solved there and then by people simply getting out the service and saying, well, this is what it says on hi4life, and hi4life is supported by the DOH in Gauteng, and so it must be correct. So we're looking at trying to make sure that everyone's got access to up-to-date, relevant health information.
How does this technology work, and what sort of information will be shared with the end user?
Well, we run through a whole load of different services, but we have Mobi sites, we have, we're getting a connection in with Mixit, we're going to be having different voice lines running as well. But the one I'm just going to show you is running through something called USSD, which isn't that common in a lot of countries, but it's very common here in South Africa. People use it for checking their airtime, loading up airtime, and even doing cell phone banking when they do have cell phone banking. And so, for example, you can simply go on any phone, you can go *120 *6336# and then dial, and you'll get a menu up of a list of different health options that you can select, like sexual and reproductive health, like around baby health care, around other services that you might, and other numbers that you may want to get hold of as well. You simply select from those menus, and then we'll send you a whole load of SMSs about that particular topic which you've said.
How much will this service cost the end user?
Well, we've been supported by the Elton John AIDS Foundation to put this particular program together. So we cover an awful lot of the costs. Some of the costs get incurred by the user. So on Cell C, for instance, the USSD is free because Cell C make it free. But on Vodacom and MTN, it may cost 20 or 40 cents for people to use. In similar, when they go to our Mobi sites like mama.mobi or baby.mobi, they will incur certain minor data costs. Usually it's like 10 or 20 cents or so, unless they're on BlackBerry, which a lot of our people come to it from, in which case it's free through their BIS service.
Connectivity in Africa is still very limited. With that in mind, how do you think this will affect the mobile health services?
Okay, I mean, certainly within Africa, there are a lot of connectivity issues, but in South Africa in particular, where we're working, It's pretty good in general. More than 60% of people have phones that can even access the internet services, and and there's about 90 or 95% coverage of basic GSM services. So connectivity on basic services isn't a big issue as far as we're concerned, and it's growing all the time. In a lot of more rural areas around, it can be a bit more problematic, and it's one thing that we are looking at, seeing how perhaps things like reverse billing and setting up more community-centric base stations could be a good solution in that in the future. But that's something that we as civil society and all other players have to get involved with the networks in selling it as a good idea, together with governments as well.